Hi friends, welcome back to the Nurse channel. So as we discussed in our last videos, we are expecting the most awaited AIIMS NORCET examinations within 2 to 3 months, and the other nursing officer examinations like ESIC, JIPMER, SCT, those examinations are also in queue. Okay, so keeping these exams all in mind, we have come up with some series of questions which will help you to prepare for the upcoming nursing officer exams, especially AIIMS NORCET. Okay, so in this video also, in the 15 questions what we are going to discuss today, we have included as I said in the last videos, picture based questions are there, and moreover we have given such a good explanation for each and every questions. And moreover, have you all heard about the disease that was occurred for the famous pop singer Justin Bieber? Okay, so it is very sad to hear, and we wish him a very speedy recovery. So we are discussing about that disease also in this session. So I request everyone who are watching this video to watch the video till the end without skipping. And once again, welcome you all back to our channel, that is a nurses channel. And whoever not yet subscribed our channel, kindly do subscribe our channel and share about this platform to your nursing friends. So straight away, without losing time, we will move on to the 15 questions which aimed at preparing you for the AIIMS NORCET, ESIC, JIPMER, SCT, etc. exams. Okay, so all the very best, and straight away we will move on to the questions. Straight away we will move on to our first question in this series, and the first question for you is from the hematology, and the question is in the screen right now. The question is, which among the following is the most abundant hemoglobin in adult humans? So question is very simple. Most abundant hemoglobin in adult humans, and the options for you are option number A, HbF, option number B, HbS, option number C, HbA, and option number D, HbB. So which is the most abundant hemoglobin in human adults? And the most abundant hemoglobin in human adult is HbA, and I will expand these abbreviations. That HbF stands for fetal hemoglobin, HbS stands for sickle hemoglobin, HbA stands for adult hemoglobin, and HbB is a beta hemoglobin that can be seen along with the HbA. So we will have a small explanation regarding the this question. So in adult humans, the most common hemoglobin type, it is a tetramer. So in the name itself, it is clear what is a tetramer. It contains 4 subunits of protein, and it is called as a hemoglobin A. This is the most abundant adult hemoglobin. Then we can see about the fetal hemoglobin, and we are getting a bunch of information from this area. So it is a major hemoglobin which is present during the gestation, and it constitutes approximately 60 to 80% of the total hemoglobin in the full term newborn, and it is almost completely replaced by the adult hemoglobin or the hemoglobin A by approximately 6 to 12 months. That means at the age of 1, and it amounts less than 1% of the total hemoglobin in adulthood. Okay, so I think it is clear for you now. Fetal hemoglobin, gestation period, in the fetal period, and when the child becomes 1 year of age, it will be completely replaced by the adult hemoglobin, and in the adulthood the percentage of fetal hemoglobin will be very less. If it presents, that indicates some or the other abnormalities. Okay, and the next one is the beta hemoglobin or the HbB. It is a subunit beta, and it is a globin protein, and it is coded by the HbB gene, and along with the HbA, it makes up the most abundant hemoglobin in the human body. Okay, so along with A, this HbB also can be seen. Okay, so that is the hemoglobin B, and the final option was regarding the hemoglobin S. So the most common type of abnormal hemoglobin. Okay, hemoglobin S is the most common type of abnormal hemoglobin, and it is the basis for the sickle cell trait and sickle cell anemia. Okay, so sickle cell trait and sickle cell anemia can be happen in patients with the HbS hemoglobin, which is an abnormal trait. Okay, so I think the first question is clear for you. You are getting some nearly answer for nearly 3 to 4 questions in the one question itself. Okay, now we will move on to the second question in our series, and the second question is from the central nervous system. The question is very simple. Anterior 2/3 of the tongue is supplied by which nerve, which cranial nerve? So the question is very clear. Anterior 2/3 of the tongue is supplied by which nerve? So we have to be careful about the part of the tongue, and it is asked about the anterior 2/3 of the tongue. Okay, so the options for you are option number A, Glossopharyngeal, option number B, vagus, option number C, trigeminal, and option number D, facial. So don't make a hurry to answer this question. Think carefully. anterior two-third of the tongue. So what is the answer? So the answer for this question is option number D, facial, and it is not glossopharyngeal. Why? That we will see in the explanation of this question. So first we will see about the facial nerve. The facial nerve is the 7th cranial nerve, as you know, and it has the sensory part which supplies the anterior two-third of the tongue, and it has the motor part which controls the facial expressions by innervating the stapedius muscles, and it has a parasympathetic activity, like its action is on the salivary and lacrimal glands. Okay, I am not explaining much detail about the facial nerve. So the answer for our question is anterior two-third of the tongue is supplied by the sensory part of facial nerve, which is the 7th cranial nerve. So we will see the other options also. The one of the options were glossopharyngeal. Okay, this is the 9th cranial nerve, and we have the sensory area is supplying the eustachian tube, the middle ear, carotid body and carotid sinuses, pharynx, and the posterior one-third of the tongue. Okay, so the posterior one-third of the tongue is supplied by glossopharyngeal, and the anterior two-third is supplied by the facial nerve. Okay, and its motor area is supplying the stylopharyngeus, and the parasympathetic activity is to the salivary glands. That's all regarding the glossopharyngeal, that is the 9th cranial nerve. And another option was regarding the vagus nerve. You know that it is the 10th cranial nerve, and the sensory area is supplying the pharynx, larynx, esophagus, external ear, aortic bodies and aortic arch, then thoracic and abdominal viscera, etc. Okay, so you know that this is the largest cranial nerve in the human body, and the motor area is supplying the soft palate, larynx, pharynx, upper esophagus, and it has the parasympathetic activity which controls the cardiovascular, respiratory and gastrointestinal systems. A very important cranial nerve, that is vagus cranial nerve number 10. Okay, so I think from this question also you are getting answer for so many questions, and this is also very important in exam point of view. Now we will move on to the another option, that is a trigeminal nerve. Okay, that is a 5th nerve, and the sensory part is supplying the face, scalp, cornea, nasal and the oral cavities and cranial durameter, and at the same time the motor area which supplies the muscles of mastication, that is the tensor tympani muscles. Okay, muscles of mastication and tensor tympani muscle. Okay, this is all about the trigeminal nerve, and you know about the trigeminal neurology and all. I am not going in depth into the topic. Okay, now we will move on to the third question in our series, and this is from the cardiovascular system. The question is, why morphine administered in myocardial infarction? So what is the indication for giving morphine in myocardial infarction? That is a question for you, and the options for you are, the first option is to reduce pain and anxiety of the patient. Option number B, to reduce the myocardial oxygen demand. Option number C, to reduce the preload and afterload, and the final option number D, all the above. So what is the reason for administering morphine for the MI patients? So the answer is, obviously you all are right, the answer is all the above, option number D. So we will see a small description about the morphine. You know that morphine is a narcotic analgesic. So morphine is administered to reduce the pain and anxiety of the patient, and morphine decreases both preload and afterload, and thereby reduces the myocardial oxygen demand. Okay, so the heart's workload will be reduced with the help of administering morphine, and it can be administered as IV bolus at 5 to 15 minutes interval. Okay, based upon the condition of the patient. Okay, so that is a role of morphine in myocardial infarction. Now we will move on to the fourth question in our series. This is a picture based question, and the question is, identify the position, and the picture I have shown you in the screen right now. You just identify the position of the picture. Okay, so the options for you are, it's a very easy question. The option number A, high Fowler's position. Option number B, Trendelenburg position. Option number C, reverse Trendelenburg position, and option number D, dorsal recumbent position. So what is this position called? Maybe slightly confusing, but you can answer it very easily. So you know that the answer for this question is option number C, that is a reverse Trendelenburg. Okay, this is reverse Trendelenburg. So I will explain regarding this reverse Trendelenburg. First we will see the other options. So the first option was the high Fowler's position, and this is a position, high Fowler's position. You can see a degree 60 to 90 degree. So the patient is usually seated upright with their spine straight. So here the patient's spine is straight, and the upper body is between 60 degrees and 90 degrees. Okay, it will be between 60 degrees and 90 degrees, and the legs of the patient will be straight or bent. Okay, sometimes it can be bent like this, or sometimes it will be straight. Whatever it is, the spine will be upright with 60 to 90 degrees to the body. Okay, so this is the high Fowler's position. Now we will see the next position, that is the Trendelenburg position. So this is the picture of the Trendelenburg position. So in that, the patient is supine. So the patient is lie down in supine on the table with their head declined below their feet. Okay, so the feet is up and the head is down at an angle of roughly 16 degree. Okay, so the 16 degree patient is down compared to the legs. Okay, so the legs are elevated. So this is known as the Trendelenburg procedures. Okay, Trendelenburg position. And we will see what is a reverse Trendelenburg. So it is exactly opposite to the Trendelenburg position, and that was a question we have asked now. So the reverse Trendelenburg position, it is a position in which the patient's hip and knee are not flexed. Okay, see here the patient's hip and the knee are not flexed, but the head and the chest are elevated. Head and the chest are elevated at 30 degree and than the abdomen and the legs. Okay, so the here abdomen and the legs are compared to the abdomen and the legs, the patient's head is elevated 30 degree, but this is in a lower position. Okay, and it is not bent also. So if it is getting bent, then what is that position? If it is getting bent, then comes the dorsal recumbent position. See here, patient is lying down in the supine line. Patient is lying on his back with the lower extremities moderately flexed. You can see the legs are moderately flexed and rotated outward. Okay, so this is the dorsal recumbent position. Okay, so I think these four positions, I think you got an idea about these four positions, and what you have to do further is just you have to find out for which all procedures and in which all conditions we have to keep the patients in these therapeutic positions. Okay, so that is important for you. You have to refer that. Now we will move on to the next question in our series. This is a very easy question. Dosage of tetanus toxoid is. So what is the dosage of tetanus toxoid? And the options for you are option number A 0.2 ml, option number B 0.5 ml, option number C 1 ml, and option number D 2 ml. So what is the dosage of tetanus toxoid? That is a very simple question for you. So you know that the dosage is 0.5 ml. So don't be confused about 0.2 and 1. It is 0.5 ml, and you know the route of administration. Usually it has to be administered intramuscularly in a heavy muscle mass like a deltoid or in the gluteus region. Okay, and what you have to learn further is the intervals at which told age we have to give the tetanus toxoid, and for the pregnant women when all we are giving the tetanus toxoid, that you have to study further. Okay, so that is fifth question for you. Now we will move on to the sixth question in our series. This is regarding the wound healing process stages. So the granulation tissue formation can happen in which phase of wound healing process? So the question is regarding the phases of wound healing process. Granulation tissue formation can happen in which phase of wound healing process? And the options for you are option number A, inflammatory phase, option number B, proliferative phase, option number C, hemostasis phase, and option number D, maturation phase. So in which phase the granulation tissues development happens? So the option number B, proliferative phase, is the answer for this question. So we will see the phases of wound healing process very shortly, very briefly. So the first phase is the hemostasis or the blood clotting phase, in which is happening within the first few minutes of the injury. And what is happening is the platelets in the blood, it begin to stick to the injured side. Okay, platelets will be rushing to that area and it will stick onto the injured side, and this is a stage of clotting. Okay, that is the hemostasis. Okay, and the next stage is the inflammatory stage, and during this phase the damaged and the dead cells are cleared out. Okay, and along the bacteria and the other pathogens or the debris, and this happens through the process called phagocytosis, where white blood cells engulf the debris and destroy it. Okay, so in the inflammatory phase the phagocytosis is happening. Okay, and there is one more hint for you, one more information for you. So the phagocytosis among these white blood cells, who are doing the most, it has already explained in our old video, so kindly go through that video and see the answer for that question. Okay, whoever didn't watch it. Okay, so that is the inflammatory phase. First one is the hemostasis, the second stage is the inflammation, and the third stage is the proliferation or the growth of new tissue phase. In this phase, the angiogenesis happens, collagen deposition happens, granulation tissue formation happens, and epithelialization and wound contraction also happening in this phase. That is a proliferation phase. Angiogenesis, collagen deposition, granulation tissue formation, epithelialization and wound contraction is happening in the proliferative phase. That is the third phase of wound healing process. And then comes the final stage, that is the maturation or the remodeling phase. And during this maturation and remodeling phase, the collagen is realigned along the tension lines, and the cells that are no longer needed are removed by programmed cell death, otherwise known as the apoptosis. Okay, so what do you mean by apoptosis? The programmed cell death is known as the apoptosis, and that is happening during a maturation or the remodeling phase of wound healing process. Okay, so I think these four stages are very important. I think that is clear for you now. Now we will move on to our seventh question in the series. This is fundamentals of nursing. From fundamentals of nursing regarding fever, temperature falls in a zigzag manner in which type of fever? So the question is very direct and very clear. Temperature falls in a zigzag manner in which type of fever? And the options for you are option number A, crisis, option number B, lysis, option number C, continuous fever, and option number D, inverse fever. So in which fever the temperature falls in a zigzag motion? So the answer is very clear. The answer is option number B, that is lysis. Lysis is the answer. So we will see these four options in brief. So what is a crisis? So crisis in the fever means the sudden return of temperature to the normal range from a very high temperature. Okay, the patients will be having a very high temperature and suddenly the temperature will drop to the normal range. That is known as the crisis. And what is a lysis? Lysis means the temperature falls in a zigzag manner for days or week before reaching the normal. Okay, so before reaching normal, the temperature will be in a zigzag manner. That is lysis. And the third option was the inverse fever. So what is inverse fever? It is characterized by the highest temperature in the morning and lowest temperature in the evening. So the inverse of what is happening, what should be happening for a normal individual. So it is characterized by highest temperature in the morning and lowest temperature in the evening. And the last option was the continuous fever, and is otherwise known as the constant fever. In this, the temperature variation is not more than 2 degrees Celsius between morning and evening, and the temperature does not reach the normal. Okay, so always temperature will be there, patient will be febrile, and the difference will not be more than 2 degrees Celsius between the morning and evening temperature, and it does not reach the normal. So that is the continuous fever. I think you got information regarding the 4 types of fevers now. Now we will move on to our next question, that is the 8th question. This is from the gastrointestinal system, and the question is, Rovsings sign is associated with which disease state? Rovsings sign is associated with which disease state? And the options for you are, the first option is pancreatitis, the second option number B is renal calculi, the third option number C, DVT, and the final option number D, appendicitis. So in which disease state you can see the Rovsings sign? Which disease? So the answer is definitely option number D, that is appendicitis. Okay, so in the DVT you can see Homan sign. Okay, so we will see what is a Rovsings signs. Rovsings signs, it refers to the pain felt in the right lower abdomen upon palpation of the left side of the abdomen. So if we palpate the left side of the abdomen, the patient will be getting pain on the right side. Okay, that is known as a Rovsings sign, and it is an indicative of acute appendicitis, which is characterized by the inflammation, infection, and swelling of the appendix. Okay, so that is Rovsings sign. Okay, so I think that question also is clear for you now. We will move on to the next question in our series, that is the 9th question. This is from the oncology, and the question is, dosage of chemo drugs is calculated based on. So the chemo drugs are calculated based on what parameter? And the options are option number A, weight of the patient, option number B, height of the patient, option number C, BMI, that is body mass index of the patient, and option number D, BSA, that is the body surface area. Okay, so dosage of chemo drugs is calculated based on which criteria? That is a question for you, and the answer is option number D, that is BSA, that is basal body surface area. So you know that in an attempt to minimize the inter-individual variation, dosing for most anti-cancer agents has generally been normalized using mg of the drug per meter square of the body surface area. Okay, so mg of drug per meter square of the body surface area, so which is calculated using the patient's height and weight. Okay, so height and weight is a parameter in the BSA, and the dose is calculated based on the mg of the drug per meter square. Okay, so the answer for our question is basal body surface area. Okay, so now we will move on to the 10th question in our series. So the question is, which among the following is an anti-craving agent used in the addiction management? Okay, so the question is regarding addiction medicine. Question is, which among the following is an anti-craving agent used in addiction management? So the options are option number A, disulfiram, option number B, metronidazole, option number C, naltrexone, and option number D, naloxone. So what is the answer? So anti-craving, that is a key point in this question. So the answer is option number C, naltrexone. Okay, so we will see the explanation of this question. So here we have to understand about the two terms, that is deterrent agents and anti-craving agents. Okay, so what do you mean by deterrent agent? Deterrent agent means so if the patient is using the alcohol again or the something addictive things again, then what will happen is it will have a very harmful effect on the body. So that those things are known as the deterrent agents. And the disulfiram, then calcium carbamide, then metronidazole, these are the examples for deterrent. Okay, so you will have a doubt like how metronidazole, so it is an antibiotic, but this also have a deterrent property which are proved in the studies. Okay, so the mechanism of biological action of alcohol deterrent agents such as disulfiram and cyanamide is by inhibition of a key enzyme that is responsible for the metabolism of ethanol, that is the aldehyde dehydrogenase. Okay, so I am not going into the details of the disulfiram that reaction, but you just understand that it is responsible for the it is producing these things will produce inhibition of a key enzyme which is known as the aldehyde dehydrogenase, which have a very bad effect on the metabolism of the ethanol. Okay, so that's all regarding the deterrent. Now we have to understand another term, that is anti-craving. Okay, so as the name indicates, anti-craving aims to reduce the craving for and use of the substances. Okay, so the craving will be reduced with the use of anti-craving medicines, and anti-craving medicines examples are acamprosate, which is a very good drug for the alcohol addiction. Then naltrexone, this is also another drug for alcohol addiction and as well as for the tobacco dependence. Then fluoxetine. Okay, so these are the anti-craving examples for the anti-craving drugs. And another option you have seen in the question was the naloxone. So don't be confused with the naltrexone and naloxone. Naltrexone is an anti-craving agent, but on the other hand naloxone is an extremely different drug and it is an antidote of morphine. Okay, so if anyone comes with the morphine poisoning, naloxone is a drug of choice to revert the respiratory depression. Okay, so antidote of morphine is naloxone. Naltrexone is an anti-craving drug. Okay, so I think that is clear for you now. Though, so that question is very important. Now we will move on to the 11th question in our series. The question is from the psychiatry and it is related to speech. Okay, so dash is a speech pattern where people put words together because of how they sound instead of what they mean. Okay, so the question you should read carefully. A speech pattern where people put words together because of how they sound instead of what they mean. Okay, so because of the peculiarity of some of the words, the patients will be using those words instead of what they mean. So there not be any meaning for the speech. Okay, so that condition is called as dash. So the options for you are, the first option is echopraxia, the second option is clang association, option number C, echolalia, and option number D, circumstantiality. So what is the answer for this question? So the answer for this question is option number B, that is clang association. Clang association. So what do you mean by clang association? So a person can associate words based on the rhyming quality and tuning. Okay, so because of rhyming quality, so the example of the clang association include, so I have written a sentence for you. I wrote the boat, overload, showed, any goat, float, toad. Okay, so there is no association or no meaning for this sentence, but the words are put together because of their rhyming quality and tuning. Okay, so there is no meaning. Like here the oat has is the rhyming quality of this sentence. Wrote the boat, overload, showed, any goat, float, toad, etc. Okay, so the people used to speak like, the patients used to speak like this in clang association. Okay, clear, no? So the other options you know very well, but still we will explain. Echopraxia. What is echopraxia? It is an involuntary imitation of the movements of the another person. Okay, so the involuntary imitation of the movement of the another person. Echolalia is the meaningless repetition of another person's spoken words. Okay, this is the words. Praxia means movements, lalia means spoken words. Okay, now what is the circumstantiality? So you know that it is defined as the circuitous and the non-direct thinking or speech that it digress from the main point of a conversation. So if you ask about the patient a particular topic, they will be telling another some irrelevant things, but they will come to that point at the end. But what is tangentiality? Tangentiality means patient will move from that topic to the another topic. Okay, so circumstantiality means within the question what we have asked, they will answer the question, but they will go around and they will come to the point. Okay, so that is circumstantiality. Okay, so that question also is very interesting and very informative. Now we will move on to the next question in our series, that is the 12th question, and this is very important. Actually, in the introduction section I have told about the disease that is caused for the pop singer Justin Bieber. Okay, so the question we will see and we will discuss about the answers. So a herpes zoster infection which affects the facial nerve and which causes deafness, vertigo and pain is. So the question is, a herpes zoster infection which affects the facial nerve and can cause deafness, vertigo and pain is. And the options for you are option number A, Ramsay-Hunt syndrome type 1, option number B, Ramsay-Hunt syndrome type 2, option number C, Ramsay-Hunt syndrome type 3, and option number D, all the above. So what is the answer? So the answer is option number B, Ramsay-Hunt syndrome type 2. Okay, so we will see what all these type 1, 2, 3. So Ramsay-Hunt was a famous neurologist, researcher, and who have developed so many theories and research, so many contributions, and some neurological issues he has named as a Ramsay-Hunt syndrome, and it includes 1, 2, 3. So the first one is a type 1 is called as the Ramsay-Hunt cerebellar syndrome, and it is a rare form of cerebellar degeneration which involves myoclonic epilepsy, progressive ataxia, tremor and a dementing process. Okay, so this is cerebellar Hunt syndrome or the type A. Type 1. Okay, so the next one is the type 2, Ramsay-Hunt syndrome type 2, and it is sometimes called as the herpes zoster oticus and has variable presentation which may include a lower motor neuron lesion of the facial nerve, deafness, vertigo and pain. Okay, and a triad of ipsilateral same side facial paralysis, ear pain and vesicles on the face, ear or in the ear is the typical presentation of Ramsay-Hunt syndrome type 2 or the herpes zoster oticus. Okay, so this was the disease which was happened to Justin Bieber. Okay, so he is having facial nerve palsy is there on the one side and other features. Okay, so this is an information for you, just an additional information for you. So as a health professionals, we should be knowing in depth about these diseases. Okay, so what is a type 3? Ramsay-Hunt syndrome type 3 is a very less common disease which is in which there is an occupationally induced neuropathy of the deep palmar branch of the ulnar nerve happen, and it is also called as the Hunt's disease or the artisan's palsy. Okay, it is otherwise known as Hunt's disease or the artisan's palsy. Okay, so that's all regarding the Ramsay-Hunt syndrome. So I think that is an informative, very informative question for you. Now we will move on to the 13th question in our series, and the question is from the OBG. Question is, continuation of pregnancy is possible in which type of abortion? So continuation, pregnancy can be continued in which type of abortion? And the options for you are option number A, threatened abortion, option number B, inevitable abortion, option number C, spontaneous abortion, and option number D, complete abortion. So what is the answer? So the answer is option number A, that is threatened abortion. Okay, so we will see what all these abortions are. So the World Health Organization defines a threatened abortion as pregnancy related bloody vaginal discharge or the flank bleeding during the first half of the pregnancy without cervical dilation. Okay, without cervical dilation, and a threatened abortion can present during the early pregnancy with lower abdominal pain and or with or without vaginal bleeding. Okay, so this is, as the name indicates, it is a threatening. So here the product of that the fetus is safe and there is no problem with the fetus, but this is a warning sign that if you are not treating properly, or if you are not dealing with the underlying cause of the bleeding, so this can go to a complete abortion. Okay, so that is threatened abortion, and that's the answer for the question. So what is a spontaneous abortion? Spontaneous abortion refers to pregnancy loss at less than 20 weeks. So here the pregnancy loss is happened, and it is less than 20 weeks gestation in the absence of elective medical or surgical measures to terminate the pregnancy. So this spontaneous abortion, it can be divided into threatened abortion, inevitable abortion, incomplete abortion, missed abortion, septic abortion, complete abortion, and recurrent spontaneous abortion. Okay, so these are the subdivisions of spontaneous abortion. Okay, so the another option was regarding the complete abortion and the inevitable abortion. So complete abortion means all products of conception have been passed without the need for the surgical or medical intervention. Okay, so without surgical or medical intervention, all the conception parts of conception has come out. That is known as a complete abortion. And inevitable abortion means the cervix has dilated completely, but the products of conception has not been expelled. Okay, so then through medical intervention or the surgical intervention, we have to remove the product of conception. So the cervix is completely dilated. That is known as the inevitable abortion. Okay, so I think that question from the OBG also is clear for you. Now we will move on to the second last question in our series. So this is regarding from the pediatrics, and the question is Apgar score between 4 to 7 indicates. So the question is Apgar scoring, and 4 to 7 indicates what? So the options are option number A, no depression, option number B, mild depression, option number C, severe depression, and option number D, profound depression. So the score 4 to 7 indicates what? So the answer for this question is option number B, that is mild depression. So I think you know the full form of the expansion of the Apgar. Okay, so what is A for activity, B for A for appearance, P for pulse, G for grimace, A for activity, and R for the respiration. Okay, so these 5 parameters are there, and for each one 2 scores can be given. So the total score will be 10, and it is a quick test which is performed on a baby at 1 and 5 minutes after the birth. Okay, so this is another information for you. Apgar is the test which is performed at 1 minute and then at 5 minutes. Okay, so this will indicate how the baby is adapting to the external environment, and how the well-being of the baby can be scored with the help of this Apgar score. And as I told, each 5 parameters have 2 score as the maximum, so the total score is 10. And if it is between 8 and 10, it indicates there is no depression, the baby is well adapted to the external environment. And if it is between the 4 to 7, it indicates a mild depression, or the mild depression in the well-being, and 0 through 3 indicates a severe depression. Okay, so I am not going in depth about the how you have to test and all. So Apgar scoring, the maximum score is 10, and these are the ranges to monitor. Okay, so I think that question also is very clear for you. Now we will move on to the last question in our series, the final question, and the question is asphyxia is the state of suffocation due to. So question is asphyxia is due to dash. So the options for you are increase in the carbon dioxide, option number B, decrease in oxygen, option number C, decrease in hydrogen ions, and option number D, increase in oxygen. So what is a cause for the asphyxia? So the answer is, you know that the answer for this question is increase in carbon dioxide. Okay, increase in the carbon dioxide. Why? So that we will see in the explanation. So the receptors found in the body, that means the receptors in the brain, are highly sensitive to the carbon dioxide and hydrogen ions. Okay, so the respiration initiation is done by it will be stimulated by the carbon dioxide, and it is not by the oxygen. Okay, carbon dioxide and hydrogen ions. So asphyxia is the state of suffocation which is due to the high carbon dioxide concentration, and the role of oxygen in regulation of the respiratory rhythm is quite insignificant. Okay, so the this one is the like what carbon dioxide is the one which sensitizes the brain to have the whether to increase the respiratory rate or to the decrease. Okay, so the answer for our question is it's because of the high concentration of carbon dioxide. Okay, so with that we have come to the end of the this session, and I think this session also was very much helpful for you for the preparation of the AIIMS examination. So I thank everyone who watched the video, and I request once again to watch the video till the end without skipping. So so keep in touch, and we will come up with another video very shortly. So till that time, see you once again. Thank you for watching the video. Bye.